applications simple and allow the municipal officials to process them without a whole lot of time and effort, and to have them processed on a rolling basis has been able to get these dollars into play to make a difference. Today's Shared Streets and Space Grant recipients include 17 communities, and some of these cities and towns awarded grants in the most recent funding round include Arlington, which was awarded multiple grants to fund the expansion of outdoor dining, bicycle racks, and the installation of traffic calming measures and new signage. Boston received funding to install 4 new bike share stations in East Boston as part of the Blue Bikes program. Charlton will use their award to improve North Main Street and create new public space by the Charlton Public Library. Haverhill received funding to provide safe outdoor dining in downtown Haverhill and improve safety in school drop-off zones. Malden will create a dedicated bus lane to Malden Station, as well as extend bicycle lanes and provide spaces along downtown streets to support additional outdoor dining and commerce. And heading west to West Stockbridge is converting several downtown public and private spaces for outdoor gathering and dining, including mounting new wayfinding and integrating public art. As you can see, these are a variety of different ideas that are designed by local officials to have an impact in their community. So we're very grateful to be able to partner with our communities across our Commonwealth in different ways, but through a simple, easy-to-access program designed by MassDOT. This is one of the things that might come out of the pandemic and last even longer. We've obviously been taking notes over the past few months about things that have sprung up and that are working, and perhaps this will become a best practice at the future of MassDOT. With that, I'd like to now turn it over to Secretary Pollack.
Thank you, Lieutenant Governor. I'm delighted to be here today and to talk about MassDOT's Shared Streets and Spaces programs and our wonderful municipal partners like the City of Salem, who we've been able to work with throughout the summer and into the fall to rethink our spaces, whether those spaces are our streets, our sidewalks, bicycle lanes, some cases parking lots and parking spaces, and to institute what we call, at least allowed us on a temporary basis to redistribute space to allow for socially distanced walking and bicycling, for outdoor restaurants, and in the most recent rounds of grants, we're also seeing more applications that focus on helping kids walk and bike to school as our schools start to reopen for in-person learning. This started as a $5 million program. Demand quickly overwhelmed that amount of money. We got the last of the applications in last week. I want to thank the Barr Foundation and the Solomon Foundation, both of whom provided technical assistance resources to help some of our cities and towns figure out the best way to redo their spaces and apply for the grants. And so with the amount of demand out there and the creative ideas we saw, we were able to double the size of the program with the support of Governor Baker and Lieutenant Governor Polito to a $10 million program. As of last week, which is when we closed the applications for the program, because the idea is quick build, stuff that you actually see this summer and fall, we had received over 300 applications. When we make the last of those grants, which we will do this week so that we can get them up and running during the month of October, we will have awarded more grants to more than 100 projects in more than 100 cities and towns throughout Massachusetts. Salem has actually received 2 grants. If I hadn't put a limit on the number of grants, I suspect Mayor Driscoll could have gotten 4 or 5, but we actually had to call her and say, we're going to try to give them to different cities and towns, not send them all to one place. So we did. I'm also particularly glad that a lot of very strong grants came from some of our red communities, where it's really particularly important to ensure, for purposes of social distancing and reducing the spread and the risk, that they build out infrastructure that helps their communities work better in socially distanced and safer ways. So in this round of funding, we're funding, as the Lieutenant Governor said, a bike share program that will benefit East Boston and Revere. We're helping Chelsea with a combined bus and bicycle lane. We're also funding a bus lane in Lynn which is one of the first bus lanes outside the immediate core of the Boston area for the MBTA, and is actually the outcome of a Lynn Transit Action Planning exercise that we undertook with the City of Lynn. We haven't even finished the action plan yet, but the Mayor McGee was so excited about identifying this bus lane that we're using, they applied for, and we're going to be funding that. The City of Worcester, another red community, is using its grant to test a bunch of traffic calming ways of helping residential streets better support safe walking and biking this fall, and with the hope of making them permanent. So it's been really a pleasure putting this program together, working with the cities and towns who have come to us with just such wonderful ideas, getting the money out there, and then now being able to go into communities and see the build out like you see here in front of the pub. It's pretty clear if you've walked through this space. This is not a space that's particularly well laid out for socially distanced indoor table dining, but it's important that businesses like this be able to serve their communities and keep their folks employed. And so by taking advantage of the street space in front of the pub and creating a handicapped, accessible, level, safe space for the diners and a safe space out in the street, it helps the restaurant and it helps the broader Salem community. So with that, I'm going to turn this over to Mayor Kim Driscoll. She's been mayor here in Salem since 2006. You got it. Since 2006, she's been she's active, not as a mayor here and on the North Shore and throughout the community. She's a great voice for thinking progressively and creatively about how our transportation system can better support our communities and our people. And with that, I give you Mayor Kim Driscoll.
Thank you, Secretary Pollack. I'll be brief. It's great to be here to celebrate this program. From a city perspective, the funding that we were able to put in place was flexible, it was fast, it not only enabled the sort of fun activities that you want to take advantage of in your community, but it helped us with transportation issues. Just the brief sample of projects that were permitted, everything from art walks to bike shares. This is going to help our local economy, help us move people around in safe ways, help mental health of getting people out in spaces that they'd love to be able to enjoy if the infrastructure's there. Most importantly, this will be with us for a long period of time. The outdoor dining, the consumer confidence that enables people who, even though you can go inside in places that can allow proper distancing. Several people comment that they feel like they're in Europe, right? All these piazzas and places that used to house cars and parking are now places where people are eating, dining, enjoying coffee, and just getting outside and being together, something that's really hard to do during COVID. So really grateful for the partnership from the state helping us with spaces like this. We're one of the communities that's on Stop the Spread. We just announced additional downtown testing. It's really terrific as a local leader to know that we have.
Just about streets. It's also about backyards. I was in Salem on Saturday night with some friends of ours, and there's a backyard behind Opus that is actually, it's like a courtyard. Yeah. It's really cool. And they're now doing several restaurants that, for whom that was the backyard that was forgotten about and never touched and never dealt with, are now all doing outdoor dining in this big, beautiful courtyard. And I have a feeling that will probably hang around for quite a while as well.
Not going anywhere.
Not going anywhere. Yeah.
Governor, since we are in Salem, could I ask you about your worry about crowds? Crowds are scary at a time of COVID, and yet Salem really relies on these people coming in. What advice would you have for the mayor about that?
Well, the first thing I'd say is somebody who's been over in Salem on a number of occasions in the fall already, just walking around with my family, the mayor has done masks. You literally can't walk more than 10 feet in the downtown area in Salem without ambassadors who was walking down the main drag that runs past the front of the Hawthorne. I don't know the names of any of the streets. Yeah. Is that the one that goes all the way, heads down? The mask has chin strap, right, like this. And as the mask ambassadors approached them, they saw the mask ambassadors, they pulled it up. The level, I don't know what the percent of people in downtown Salem is that are wearing masks and doing what they need to do to stay distant, but I'm guessing it's way north of 80%. And 95? I mean, they are really working this and working it hard. And so point number one, you know, there's no question there will be people in Salem in October. It's It's like the swallows going home to Capistrano or wherever it is they go. It just is going to happen. But the work that the mayor and her team have done to establish a culture here of wearing masks and socially distancing and recognizing and understanding the issues associated with this is pretty powerful. And I've talked to her twice about this and have said, if there are things that we can do to help you work your way through the fall and to work your way through the month of October, we're happy to do that with you. But I recognize and understand, and I think she does too, that people will come.
Can you elaborate a little bit about why no statewide mandate when it comes to trick or treating? Doctors say the virus doesn't care about borders, and if you're a high-risk community, chances are you might border a lower-risk community, which might border another high-risk community. So, can you explain a little bit more, why no statewide uniform policy? Why leave it up to the community?
Well, we're going to put out plenty of guidance, as I said before, but we're going to expect people to make decisions on their own at the local level. I mean, point number one here is I had a whole bunch of people say to me, why don't you just cancel Halloween? And the reason we're not canceling Halloween is because that would have turned into thousands of indoor Halloween parties, which would have been a heck of a lot worse for public safety and for the spread of the virus than outdoor, organized, and supervised trick-or-treating. And I think our view on this is there are some very simple things that people can do to manage their kids and themselves with respect to Halloween outdoors that most people would agree is a heck of a lot safer than what they might choose to do as an alternative. And so we're going to put the guidance out on that, and we're going to let locals hopefully communicate that in their communities. But if people want to go beyond that, as they do in some cases, you know, that's up to them.
Governor, have you decided, are you holding trick or treating here in Salem?
We're contemplating working with our Board of Health officials to give guidance. I mean, Halloween, you're in a city where we're purists. Folks are probably going to go out. And we feel like there's family decisions that if you are a family, we have throngs of tourists that are here. And if families can safely, certainly following those directives and guidance in small groups with masks, go out, we would love to be able to enable that. And if residents don't feel comfortable having people come, there are ways that you can turn off porch lights and give that direction as well. So we're hopeful that we can provide guidance without putting any mandates in place around people's activities.
Can you talk a little about the ambassador program that the governor mentioned? How is that working?
Yeah, we've got downtown ambassadors that are neighbors that we deploy on a routine basis to help remind folks about masks, pass out masks, let people know when their masks are being improperly worn. We track the number of people they see with masks on, those that are being worn properly and those that are not, and that's how we're able to create a culture where if you're in downtown, you're expected to wear a mask. Now, it's not 100%. We got a few folks from out of town for whom wearing a mask for them is a political decision, and we have folks who have health conditions who sometimes can't wear a mask. But for the most part, it's been really strong compliance, and it's terrific that it's a neighbor. It's not necessarily an armed individual coming up to you. It's somebody who lives here, who cares about the community, who's handing you a mask, and just trying to communicate in a way that leads to compliance.
Are you
It's been strong.
fining people, scofflaws?
We are, but fines are very, very few. I mean, imagine the interactions of trying to find somebody, tracking them down, getting their name. All they have to do is say they have a health condition and they're waived of the requirement. So we found that education, if we're getting 95% compliance by educating people with downtown ambassadors, we feel like that program's working.
Governor, can you expand on the Trump?
Let me say one other thing on the mayor's comment about that. You know, Salem was the first community that took really seriously this idea of messaging and message boards and signage. It was, I mean, you were putting this stuff up in April and May, and we stole that idea, and one of the biggest things we've brought to many of the communities that are high risk is a commitment to give them, in multiple languages, signage that they can put in the places where they think it would be most appropriate, along with a bunch of digital messaging and a whole bunch of other things. I mean, you got to start with messaging, you know, and make clear to people that it's expected that you're going to be wearing a mask, socially distancing if you're in this part of town. And I think they've done an effective job with that. Go ahead.
Governor, the way that Trump handled his bout with the disease, is there any concern? He was saying that, you know, don't be afraid of it. We talked to the woman from Framingham whose grandmother, who's in the globe. She said that her grandfather believed that not wearing a mask would be fine, and they say he passed away. How dangerous is it for what the president's portraying while dealing with the actual virus?
Well, I think part of the argument that's come from us and from the CDC and from folks like the mayor and others is that this is a very contagious virus, and it can have horrible consequences for people, period. And the amount of asymptomatic transmission that's out there and the number of people who will get it. I mean, part of what creates this sense of, oh, it's not that bad, is there are many people who will get it who will never show any symptoms. But they're perfectly capable of giving it to all kinds of people who will be horribly negatively affected by it. And I think all of us in public life, and I would include the president in this category, need to carry the message that while this thing may not be bad for some, it can be deadly for others. And if we are serious about being all in this together, we all need to do the things that stop the spread. And that starts with wearing a face
Well,
covering.
what he says is that the message, all the work you guys have done over the past 6 months, I mean, he just comes out of the hospital and barks out these outrageous things.
Well, his own CDC says you should wear a mask and says this disease is contagious and says for many people it can and will be deadly. And I have said many times, and so has the Lieutenant Governor, that we're incredibly grateful for the fact that here in Massachusetts, the message coming from electeds at every level is all the same. I mean, there are very few elected officials in Massachusetts, very few public health officials, very few researchers and scholars who are coming at this with any message that's any different than ours. And I do think that helps with things like compliance and participation. I mean, we talk a lot about the fact that if you walk around most downtowns in Massachusetts, the vast majority of the people are wearing masks. And you know, whenever I hear somebody who says, you know, it's not that dangerous, first person I think of is Robert Lewis Jr., who runs the base and is a good friend of mine and the Lieutenant Governor's. He came this close to dying, and he's in his 50s. And, you know, the most alive guy you could ever spend time with. And on some level, it's a miracle that he's still with us. And there are plenty of stories like that. And then there are the stories like the one that you just told about somebody who was about my age who got it and didn't make it. There are 200,000 people who died from this thing. And many others who didn't die because they were saved by the healthcare system. It is a brutal, vicious disease for those it negatively impacts. And it is horribly contagious to begin with.
Governor,
Those are the facts.
Governor, could you speak to the trend that's been going the past couple of weeks? It's not spiking, but it's going up. Is that concern for you, or should we be prepared for possibly another surge?
So people started talking in the spring, okay, about the fact that it was likely that we would see an increase in cases in the fall. And that was part of the reason why we started saying back in May and June that we wanted to be testing at least 50,000 people a day when we got to the fall. Because the first way you compete against this virus is by identifying it. And we're now testing, you know, roughly 65,000 tests a day, sometimes as high as 80,000. We're testing more in places where we have particular concerns, which is why we have 18 Stop the Spread communities and why we're testing so aggressively on college campuses and college students generally. I think that's exactly step one, the right thing to be doing here. There are 10 states in America that are testing at or above the federally recommended per capita test guidelines. We're one of those 10, and in fact, we are number one among those 10, and we're testing at 300% of the federal guidelines, okay? We are testing aggressively because we want to identify cases, and once we identify those cases, connect them to contact tracing so that people will isolate and quarantine and do all the things they need to do to try to stop the spread within their own communities and within their own households. And to do the backwards tracing to figure out if there are things we need, people we will learn about who we need to connect with. But I think we expected and anticipated that there would be an increase in the fall, and that's why we built such a significant infrastructure around testing and tracing. And we still talk to the hospitals every couple of days about how many cases they have, how many active cases they have, how many suspect cases they have, how many cases they have that aren't actually COVID cases, but are people who are there for some other reason. And we're still talking about pretty small numbers when it comes to hospitalized COVID patients, a couple of hundred, which, as you know, is down from almost 4,000 at the peak of this thing. And I think what I would say is that the most important thing we have done is create an infrastructure to identify and support people who test positive and to continue to build relationships through conversation and support with our healthcare community so that if they have PPE issues or any issues associated with their ability to serve people, we can help them do it. The other thing we've tried to do is reframe some of our messaging because the fastest growing group of newly positive cases in Massachusetts are people between the ages of 20 and 30. That's going to be a tough sell for all of us for all kinds of reasons. But we've certainly altered some of our messaging to try to get more attention applied to that community because in some respects they are, at this point in time, 3/4 of the new cases in the last 14 days.
Governor, Salem is one of several communities not moving forward with step 2 of phase 3, even though by the state's guidelines they could. You said you're expecting an increase in the fall. Some in the medical community say, why move forward with this next step then?
Well, first of all, you can only move forward if you were a low-risk community to begin with. And secondly, we left it up to folks like Mayor Driscoll to make the call if their circumstances were particular. Now, she has a very particular set of circumstances, and it's called Halloween. I mean, she's going to have hundreds of thousands of people here without advertising, without, encouraging and all the rest, and hopefully most of them who come will have appointments and arrangements made about where they're going to stay and where they're going to go and all the rest, so they're not just standing in line outside. But, I mean, you'll probably have more people here from outside Massachusetts than anybody else. So she's playing a very different hand than some others are playing, and I don't blame her for not going forward.
Okay. Back to the restaurant situation. It seems like every day we find out about a new restaurant. I mean, there's the iconic Cheers replica bar. There's the Kinsale we're just finding out about at Crossing Boston City Hall. Do you have concerns that the outdoor dining may not be enough to what looks like a changing landscape for the restaurant industry in the state?
Well, I think the biggest challenge we all face with respect to restaurants generally is the changing mores and habits of people generally in a COVID world. I mean, if you talk to anybody in the food business, and we talk to people all the time in the food business because we're constantly working on updating and enhancing and improving our food security programs, I mean, they'll tell you point blank that the amount of product that is being sold these days to people for in-home dining is through the moon relative to where it was in January or February of last year. And that's because more and more people have literally, either because, they're working from home more than they used to working from home, or because their kids are at home because they're learning remotely, or because they're just concerned about going out at all, more and more people are having meals at home that they used to have in restaurants. And I don't know if that's a permanent change or a change that's just consistent with the way people are dealing with this issue during COVID. But we've worked quite hard and have managed to pass a number of pieces of legislation specifically designed to help the restaurant industry, and we'll continue to work to do that going forward. But people, not just in Massachusetts, but across the country and the world, have made some major changes in the way they live in response to COVID, and I don't think any of us knows if those changes are going to end when COVID ends or sort of recedes if there's a vaccine. or if those things are going to be just big changes in lifestyle generally.
Governor, in August, you said the state's goal was to keep positivity rates below 5%, and that reversing reopening was a possibility if metrics got worse. With cases, hospitalizations trending up to the highest point since the spring, is that still your position?
Yeah. If you actually talk to the hospitals, as we do every couple of days, the number of active COVID cases is plus or minus 250, which again is eminently manageable in the context of where we were last spring or last winter. And our positive test rate, as I said before, is 1.1%, which is completely consistent with where it's been for a long time. The number of tests has gone up dramatically, and we're testing in places where we want to find positive cases because we believe they may in fact be there. And we have a contact tracing program that's robust enough to help the folks who get identified as positive cases isolate and quarantine and do the things they need to do to be supported so that they don't pass it on to others.
Is that 5% figure based on the number of tests or the individuals tested?
I'm not sure I understood the 5% part of your question. We haven't had a 5% positive test rate in like forever.
Well, my understanding is that there's a difference between the individuals who have been given a test and the number of tests given at a given time. So
That's true.
There's some confusion about which of those is the threshold number.
Well, the one I care about is the total number of tests, and I'll tell you why. If we hadn't done any testing at all, I would care about new tests, all right? But when you get to a point where fully a third of your population has been tested at least once, and you've done 4.5 million tests overall, which means a whole bunch of people have been tested more than once, either because they've traveled to some state where they need to get tested before they come back, or because they've come here from some other state and need to get tested to be able to not quarantine when they get here, or because they've been close contact to somebody more than once. I mean, there's a lot of different reasons at this point why somebody would have been tested more than once. But I believe it's important for us to keep track of everyone who gets tested, and I especially believe when you get to the point where a third of your population has been tested and you have testing capacity to test people regularly, especially in high-risk communities, that's a good thing, not a bad thing, but those people absolutely belong in the denominator. I mean, if you test somebody on a Monday and they test negative and they're in a high-risk community and they end up having some sort of close contact with people who they believe have tested positive or do test positive, and they come back on Friday and get tested again, yeah, I want to know that they tested negative the second time.
So if there is a threshold of 5%, it would be on that total test number?
From my point of view, sure, yeah.
Thanks, everybody.
Governor, we had a report out today that said that COVID-19 complaint hotlines have gotten like 200,000 calls. How helpful have those been in rooting out businesses that may be in violation of the protocols?
Well, as is always the case, whether you're talking about the ABCC or the DPL or the DPS or whoever, they have a, what would I call it? They have a triage project that they use to separate out what they consider to be legitimate issues from issues that really would not be part of what we consider to be their mission or their statutory responsibility. If you take the ABCC, for example, if somebody calls them up and says, you know, the restaurant in my neighborhood has become a bar after 8 o'clock at night, and there's a whole bunch of people who are not ordering food, who are standing, who are close quarters, you know, blah, blah, blah. That's the sort of thing the ABCC would go check to determine if, in fact, that's true, because that is what we would define as a high-risk activity in a COVID world. DPL, if somebody called them up and said, the barbershop in my area is a barbershop during the day, but at the end of the day, it's becoming a place where a whole bunch of people are just sitting around and having drinks and talking without masks and without distancing, they would probably go take a look at that too.
Thanks,
Is the
guys.
eviction moratorium expiring next week? Are you planning to do anything with that? Or are you just going to let rely on President Trump's CDC ban?
We've been spending a lot of time with our colleagues in the court system and in the housing community, and our goal is to put together a program that makes sure that we create what we would describe as stabilization for people. But we need to create a process here, and we need to get moving on delivering on that process.
Will that be ready by the time you?
Yeah.
Thanks,
Thanks,
guys.
everybody.
Thanks, Governor.
Thank you. Good to see you. see you. Good. Thanks for coming to Salem. Great.